This portion of the news is brought to you by Inspiration Senior Living, where we provide affordable elegance to Pahrump area seniors. Give us a call at 751-2300 and make an appointment to tour our community.
Financial incentives for physicians or patients are one way healthcare organizations are trying to improve health outcomes. A new study examined whether providing financial incentives would help improve LDL or the bad cholesterol level in people at high risk for cardiovascular disease.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
You want to get your vital signs this morning?
In addition to vital signs, a visit to the doctor's office often includes a discussion about cholesterol levels, especially if a patient is at high risk for cardiovascular disease.
You can substantially reduce that risk if you take statins or other medications to lower your cholesterol. Many patients aren't taking statins, or if they are, they stop them after a few months.
And what we did in this study was to test a variety of strategies to try to help patients and their doctors get their cholesterol under better control.
Doctors Kevin Volpe and David Ash from the University of Pennsylvania and co-authors studied the effect of different financial incentives on cholesterol levels in more than 1,500 patients at high risk for cardiovascular disease. The researchers randomly assigned 340 doctors to one of four groups. One group didn't receive any financial incentives. In another group, financial incentives were given only to the patients who showed improvements in their cholesterol.
We also tried different approaches, including giving financial incentives to physicians or giving financial incentives in a shared way to both patients and physicians.
The most effective way of improving cholesterol control was a shared incentive between patients and providers.
They had the greatest reduction in their LDL cholesterol.
If patients weren't on statins, they were started on statins, having both the provider intensify therapy as appropriate and having the patients take those medications once prescribed. And that's really why we think the shared incentive group was the most effective.
We shouldn't just think of these as mechanical economic transactions. Getting your cholesterol down is a team effort. It requires physicians to prescribe the medications, and it requires patients to take the medications.
Both of those are critically important to the end goal of improving LDL cholesterol and reducing cardiovascular risk.
Catherine Dolf, The JAMA Report.
LDL levels improved 25 points in the group receiving no financial incentives. Incentives given to physicians only and patients only did not work as well as when incentives were given to both physicians and patients. The Nye County Commissioners had a discussion regarding a $200,000 grant application for the U.S. Environmental Protection Agency for an environmental workforce development and job training grant to continue to expand Nye County's existing job training program.
It's a presentation and a discussion on a draft application for grant funding in the amount of $200,000 for the U.S. Environmental Protection Agency for environmental workforce development and job training grant.
Mr. Chairman, I just wanted to say something to Mary Dawn. This was very well put together. The background information, the backup information was fantastic. I'd make a motion to approve.
Second.
Any comments? Mary Dawn?
We have a couple people down here.
Good morning, Commissioners. Eileen Christensen from Beck Environmental is here, and she just wanted to give a tiny presentation regarding this grant.
Well, you have a motion and a second.
We already have a motion and a second, so
okay.
Eileen, do you want to go past that, or?
I was just going to offer that if anyone wants to take a look at the final draft, once the employers have submitted their final surveys, to please feel free to contact Mary Dawn's office, and we can forward them copies and any additional information they'd like if they have questions.
Any other comments?
Yeah, one. I am also fully aware that you had your fingers in the middle of this a lot, Eileen, so thank you so much. This is very professionally done. The backup is great. Thank you.
We appreciate the help, believe me. With that, any other comments? With that, call for the vote.
Aye.
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 Aye. 5-0, thank you.
Alana Murphy was taken into custody after police contact found that the female may be under the influence of narcotics. She allegedly admitted to police that she had used methamphetamine within the last 24 hours. An officer proceeded to pat her down and found a hypodermic needle hidden in her sleeve. The officer and Murphy relocated to Murphy's parents' house with Murphy's consent. Upon arrival, the officer found 2 lockpicking devices and 2 plastic baggies that used to contain meth. She agreed to a urine sample and came back positive for amphetamines. She was arrested for various charges and transported to the Nye County Sheriff's Office. Metro is now officially responding to minor traffic accidents that do not involve injuries. Under former Sheriff Doug Gillespie, the department stopped responding to the minor accidents in March 2014, saying that the force was stretched to its limits because of budget constraints. The move then was designed to free up 250 hours a week for officers to perform other duties, such as traffic law enforcement, to help reduce traffic fatalities. And we'll be right back for more from News 46.